Welcome to The Explainer. Today, we're going to talk about a silent crisis unfolding across Africa. It's one that claims thousands of lives, holds back entire economies, and is being fought not in big, fancy hospitals, but on simple wooden benches. To really get a handle on this, we have to start with a story from May 2024 that just ripped this hidden crisis out into the open. As this quote says, it took a couple of real tragedies to force a conversation that was long overdue. So get this. In the span of just 5 days, two really well-known community figures took their own lives, an archbishop and a young man studying to be a priest. These events sent shockwaves through Tanzania, and they forced this really difficult public conversation about mental health. But what happened there? Well, it wasn't some isolated thing. It was a symptom of a much larger challenge facing the entire continent. All right, so let's zoom out a bit, because when you look at the bigger picture, the data, it tells a really stark story. According to the World Health Organization, Africa has the highest suicide rate of any region on the entire planet. We're talking 11 deaths for every 100,000 people, which is higher than the global average. And honestly, a lot of experts worry that because data is so hard to collect, even that really high number might be an undercount. But here's where the picture gets even more alarming. When you break the data down by gender, the risk for African men is particularly high. Their suicide rate is nearly 50% higher than the global average for men. That's a tragic statistic, and it's often made worse by cultural pressures that can make it really hard for men to ask for help. So you have to ask, right, why is this happening? Well, this chart here pretty much says it all. It's the staggering difference in investment. Back in 2020, African nations spent less than $1 per person on mental health. Now, compare that to Europe, which spent over $46. That kind of gap in funding, it has absolutely devastating consequences. And that lack of investment creates what you could call a human resource desert. On average, the whole continent of Africa has just one mental health worker for every 100,000 people. The global average is 9. So you can see this huge gap between the number of people who need care and the number who can actually get it. You know, beyond the absolutely tragic human toll, the lives lost, the families just shattered, there's this profound economic impact that is almost completely overlooked. An entire continent's potential is literally being held back. So how does a health crisis actually become an economic one? Well, our recent study shows this powerful ripple effect, and it proves how untreated mental illness is actively draining economic growth right across the continent. For the very first time, research published just this year in Global Transitions gave us real macro-level evidence of this connection in Africa. They looked at 45 different countries and found this undeniable link between widespread mental health issues and how a country's economy performs. So here's how it works. When conditions like depression and anxiety become really common, they just hammer the productivity of the workforce. The study found that this drag is so powerful that the negative impact of mental illness can actually cancel out and even outweigh the positive work from the rest of the labor force. The whole economy just slows down. And the numbers? They are just staggering. The study estimated that over the long run, these mental health issues can slash a nation's economic growth by anywhere from 53% all the way up to 100%. I mean, that's a gigantic loss of potential for economies that are already pretty fragile to begin with. Okay, so those are the big abstract numbers, but what does all of this chronic underfunding and economic strain actually look like on the ground for real people? Let's go back to Tanzania, which is really a microcosm of the challenges across the continent. For a country with over 65 million people, there is only one dedicated national mental health hospital. One. This single facility, Murumbe Hospital, is just struggling with overcrowding and severely limited resources to try and serve an entire nation. And without proper community care, many people don't get treatment. Instead, they end up in the criminal justice system. This eyewitness account, it's harrowing, but it reveals the desperate, almost medieval conditions that you get from a total lack of resources. People here aren't being treated. They're just being contained. But I know this all sounds incredibly bleak. Amidst this picture, though, an innovative and surprisingly simple solution is taking root. It's a story of hope that started in Zimbabwe, and now it's spreading across the world. It's called the Friendship Bench, and the model is just beautifully simple. They train trusted community members, often grandmothers, in evidence-based talk therapy. And then these grandmothers offer free counseling sessions on a simple wooden bench, making mental health care accessible, affordable, and, culturally comfortable. The process is so straightforward, but it's incredibly powerful. Grandmothers are recruited and trained. They hold these structured counseling sessions, and through these conversations, they empower people with the actual problem-solving skills they need to manage their mental health. It builds a system of care right where it's needed the most. And the thing is, it works. As the founder, Dr. Dixon Chibanda, notes here, the impact has been just remarkable. Over 600 grandmothers have delivered life-changing support to more than 30,000 people. It just proves you don't always need some high-tech facility to make a huge, huge difference. And this right here just brilliantly illustrates how powerful this simple idea is. The Friendship Bench has been so successful that it's been adopted in other African nations, and it's even been brought to New York City. A simple, effective solution born in Africa is now going global. So it kind of leaves you with this one big question, doesn't it? In the face of a crisis that's defined by these overwhelming numbers and a huge lack of resources, the Friendship Bench shows us that sometimes the most effective answer isn't just more money or more hospitals, but simply more human connection.